Man is to technology what the bee is to flower. It's man's intervention that allows technology to expand and evolve itself, and in return, technology offers man convenience, wealth, and the lessening burden of physical labor via its automated systems. This pandemic has taught us many lessons, and the best lesson I have learned is COVID-19 has challenged healthcare more than anything else in the recent history to quickly adapt and work in new ways to meet the demand of the healthcare crisis. This pandemic has also revealed the need for additional investment in technology and medical research. Healthcare systems need to focus on shifting from reactive to proactive care. Technology is not inadequate. Our ability to use technology that benefits us is the basis of my idea, a health bot. India has shortage of doctors and healthcare workers. Low supply of healthcare workers is quickly becoming the biggest challenge to meet patient demand. What will happen if timely action isn't taken to close the gap in the years ahead? Healthcare workers are the key to solving our greatest health challenges. Additionally, 18 million health workers are needed primarily from lower and middle income countries to get universal health coverage by 2030. Friends, can you guess how many nurses serve 1,000 people in India? Only 1.7 per thousand. Also, while 68% of the population live in rural areas, only 40% of the health workers are settled in those regions. While most countries are focusing on industry, innovation and infrastructure, which is probably ninth in the order of priority by United Nations, good health and well-being is far ignored by the world. Isn't this a story of an impending crisis? On one side, there is an increasing demand of health workers in hospitals and at home for taking care of the aging population, while family members and friends fail to attend these gaps. They too have full-time jobs and other obligations and thus cannot meet the need. So, what's the solution? Robots? Yes, you heard it right. If robots can help in serving food and manufacturing luxury cars, then why not in healthcare industry? We have invested a lot in making industrial robots. Around 4 million robots will be working in factories by the next 3 years. Technology, especially the use of machine learning, ML and AI can help in the struggling healthcare network of poor and developing countries, including that of India, to cope with the vast imbalances in the healthcare distribution. Now, let's look at some real-world use cases for robots in healthcare industry that exist today or are very close in reaching the market. Robots in surgery and orthopedics. Early 2019 saw the first documented case of a surgeon performing a surgery over a distance using a robotic assistance and a 5G internet connection. Microbots in disease detection and treatment. From large arms to tiny, capsule-sized robots that aid in disease detection and treatment. Chatbots and bedside robots. Patients can now speak to a chatbot to describe their symptoms and have their case prioritized or immediately elevated to a real doctor based on the analysis. HealthBot is a powerful tool in the fight against COVID-19, and here's why. HealthBot in medicine help by relieving medical personnel from routine tasks. It can ensure that health workers don't contract virus like COVID. Doctors can find their time out to focus more on pressing responsibilities. They can make procedures safer and efficient. So here's the future, a small helping health bot. What can a health bot do? It can assist with multitude of tasks that need to be performed on an hourly basis like basic regular checkups, including temperature, blood sugar, stress, oxygen levels, also heart rate monitoring, timely reminder of medicines through alarm setting. Not only this, but it can also register data in the systems, detect any fluctuations in the body, and can send alert to doctors for timely action. But all great things also come with challenges. To put trust in a robot is still not there. Robots cannot give the warmth and the human kind of attention. According to the World Economic Forum, one-third of the surveyed patients wouldn't trust a robot with a routine tooth cleaning. Two-thirds wouldn't trust a robot to perform more complex surgeries like root canals. Healthbots are very expensive in the current market, so there is a rush to make it a little reasonable. If ISRO scientists can make Chandrayaan-2 at less than 1,000 crore, which is much lower than the Western countries, collaborative approach between the industrial sector, space sector, and the medical sector will surely drive the cost to a more affordable segment. The future of healthcare technology is truly awe-inspiring. Industry insiders know more than what they can say. They have seen amazing things. Advanced imaging, simulation, robotics, artificial intelligence will revolutionize the art and science for better patient care. So friends, are you ready for a health bot?